All right. All right.
Can I start?
Yeah, I'll just try.
Can I start?
Yeah, I'll just try.
Can I start?
Okay, can you see this?
Yeah, okay.
Yeah, I'll just try.
Can I start?
Okay, can you see this?
Yeah, okay.
Yeah, I'll just try.
Can I start?
Have you shared the YouTube link also? Can you share it with me also, please? Huh. Y'all can maybe also have a registration link, like a Google Meets, sorry, what am I saying? Google Forms or something. So how many people are joining from where all. I guess that'll help you statistically as well to know, like, also what people want to talk about and things like that. You can have like a Google form to do that. Huh. Huh. Yep. No, I think because when y'all generally have these webinars, because if you have like say a mailing list or something, because you have the forms from who all have attended in the past and who all would like to, then you can sort of send it out personally to them as well. I mean, that's what most organizations do, when they have any kind of CEs or webinars, etc. Like especially if someone's shown interest in a particular field and you are having a webinar for that, then you can you can have your target audience. Can I start?
Okay, so shall I start?
And do you want me to share my screen now, or is Akriti? I'll let Akriti speak first.
I have to introduce you, and then you can start. So on the occasion of World Turtle Day, I'm so glad to introduce you. Thank you so much for being here, ma'am. To introduce our speaker, Dr. Henna. Dr. Henna has completed a bachelor's in veterinary science from Bombay Veterinary College in 2013 and master's in conservation medicine from Monash University, Australia in 2015. She has done a course in wildlife medicine in South Africa and has worked with a plethora of birds, reptiles, large mammals, and carnivores. She has worked at Perth Zoo and Kanyana Wildlife Rescue Center, where she has treated a wide range of animals and birds. She specializes in birds, turtles, tortoise, snakes, rabbits, guinea pigs, hamsters, and all kinds of exotic animals and native wildlife also. She runs Critter Care Veterinary Clinic in Mumbai that I would love to visit anytime soon. And the clinic is primarily an exotic and avian pet practice, along with medicine and surgery of urban wildlife. She is also a consultant and a part of Wildlife Trust of India's Emergency Response Network. She was a part of Sambar Lake Bird Rescue in 2019. Dr. Henna, did I already say that I'm so glad that you are already here? And if you can go on with the presentation, I'd love to see what you have in.
All right. So, good morning, everyone. It's great to be here, and I'm very excited to touch upon a lot of clinical aspects of what we see as exotic vets in Bombay, at least. I'm sure you see a lot of these cases even in college or wherever you're working. So I guess I just want to give you a little more insight on how you could possibly get a better hang of these patients and how we can do better for our patients as well. Okay, and I want this to be an interactive session. So it would be nice if we can have a back and forth, we can talk about cases. Okay, so even if during the middle of my talk, if you want to say something, please, I think there's a hand raising icon here, so please raise your hand. I think Akriti, you can just let me know if someone raises their hand, and we can take their questions as well. Okay, even if it's
Yes,
in the
sir.
middle of the presentation, because this is going to be a back and forth. And again, if I ask questions, it's okay even if you don't know the answer. Say whatever comes to your head, okay, because that's the only way we can brainstorm and we can have a lively discussion here. All right, let's start.
Yes, sir.
Okay, can you see my screen?
Yes, ma'am.
All right. So today we are talking about common clinical conditions in birds and reptiles. And as Akriti said, I'm Dr. Henna Ganjwala, and I run Critter Care Veterinary Clinic here in Mumbai. And y'all are welcome to come and visit. And if you want to learn about cases, etc., I'm always open to people coming to the clinic. All right. So, there are certain important considerations that we want to look at when it comes to exotics and when we see exotics in practice on a regular basis. Okay, you need to have a thorough history of the patient. The owners are definitely going to lie to you. Okay, the same question that you asked 5 minutes ago, if you ask it again, you'll get a different answer. So it's up to you to kind of we have to be interrogators, we have to sort of be detectives to get to know what is actually going on with our patient, because they might say, no, this happened just yesterday. Of course it didn't happen yesterday. If the tortoise is like a sandwich, I mean, it's as soft as a sandwich, so it definitely did not happen yesterday. So there are certain things you have to keep prodding, especially when it comes to diet. When we ask patients about what do you feed your pet, what do you feed your bird, we're like, no, no, he just eats bird food. Then you have to be, what kind of bird food? And they'll be like, no, just seeds and some fruits, and sometimes he likes wafers also. He likes chips. And then that's how you slowly then like, oh, okay, does he like biscuits also? Oh yeah, he loves biscuits, he has to have biscuit and chai every day. There's your problem. Okay, so you have to slowly start build a rapport with the owner. Start getting a good history on your patient, because half your diagnosis is done then and there. All right. Okay, your owners are going to lie to you, but the patient will never lie to you. Look at your patient, give them time, especially with birds. Observe them from a distance. When they're quiet, let them calm down, because they are already, when they come to the clinic, they're in a new environment, they're scared. And birds are known to hide their sickness. Okay, they will mask any kind of sickness till it's so bad that they're ready to die. So a bird will look perfectly healthy to you. It's chirping, it's cleaning, it's doing everything. But as soon as you leave it alone, you'll start seeing that it's sitting puffy, eyes are closed, he can barely lift his head up. Okay, so you need to observe your patient. The symptoms that your patient will show you when they are at quiet and at peace is of great value when it comes to examining your patients. Now, a physical examination is extremely important. Okay, we do a lot of other diagnostics, but what your hands can touch and feel, which is why a lot of times online consults don't work very well with patients, with especially in veterinary medicine, because you need to touch and feel your patient to actually know what's going on, because you can't get a complete history from just talking to the owner or just looking at photographs or videos. Okay, you need the patient in your hand. So with birds, you need to start with examining their chest, the keel muscle. Is it very bony? That means the bird hasn't eaten in days. It's skinny. Is it very fat? That means the bird is overfed, it's obese. Okay, is it just right? Okay, the bird is all right, not too bad. Reptiles, you need to feel, chelonians especially. You need to feel the shell. Is the shell soft? Is the shell the right shape? Is there any swelling anywhere? You need any swellings, you need to touch with your hands and feel what kind of swelling it is, because that will tell you what you need to do next. Okay, so use physical examination very, very well when it comes to your patients. Auscultation, yes, but most of your patients are going to be so freaked out by the stethoscope that the heart rate is going to go crazy high. But that is still, it's an important thing to do. So especially, you can't auscultate your turtles, tortoises very well, but yes, you can do that with birds. Uh, so what I normally do is I get the bird to befriend me first. This is, of course, only with birds that are friendly. But it takes time. You gain their trust. Let them play with the stethoscope. Don't let them break it. Let them play with the stethoscope. Slowly, slowly, slowly start moving it and put it on the chest. You need about 5 seconds of hearing their heart rate, etc., to know what's going on. You can hear any kind of maybe moist trails or wheezing, etc. All right, that you might be able to hear while auscultating. Now, another very, very important diagnostic tool is radiographs. Okay, you need to take X-rays. I X-ray almost every patient that comes to me, because there are a lot of things you can't see externally, but you can see them very well on an X-ray. And also, it gives you the evidence to tell your client, look, this is what it shows. Okay, so, and then you will get a lot more history again when you tell them, oh, but the X-ray shows this, and they'll be like, oh yeah, yeah, he was actually eating some of my earrings the other day, and he might have swallowed a piece, because we saw a piece of metal in the X-ray. All right, so X-rays are important, and usually I like to take at least 3 views. Okay, 4 would be also great, but minimum 3 views. So that would be for birds. It would be a ventrodorsal, a left lateral, and a right lateral. Okay, both sides, because then it gives you at least a three-dimensional view of what you're seeing. Okay, would love sedated X-rays. Okay, if you have access to gaseous anesthesia, it's a great tool to get amazing X-rays without stressing your patient out, without you getting exposed to radiation. Okay, so sedated X-rays are highly, highly recommended. For Yes, no, I'm not right. Yeah, I'll tell you when I get to the next slide. These are just the points that are on the screen right now. Yes. Oh, that's not changed, huh? Oh, I think this is a problem with Google Meets. Okay, now has it changed? I'll have to keep doing this. This always happens with Google Meets. Okay. Okay, so now can you see the important considerations? All right. Okay, so we were on radiographs. Okay, so for turtles and tortoises, I like to take at least 4 views. Okay, so one would be a dorsoventral view, then again the left and the right lateral, and then an AP view. An AP view basically is with the beam towards the head. Okay, So your basically the head first view sort of. Okay, so that gives you a great view of the lungs, of the or whether there's ascites. You get to see a great the intestines, etc. So four views in reptile in chelonians especially are really really important. Um, Hematology, biochemistry. Again, we are now doing it very regularly. So it is important to draw blood. Okay, again, do not draw blood in a patient that is already anemic or is about to die. Even when it comes to your physical examination, if you have a bird that is gasping for breath, you're not going to actually sit and touch it and feel it and see what's going on. You need to throw that bird in the oxygen chamber first. Okay, so it changes from case to case, but these are some of the basic things that you need to do eventually when you're examining any patient. So blood tests, yes. Again, we have a lot of owners who don't agree to this, but we convince them by saying, "Listen, we're going to get a better diagnosis if we do this, and we don't want to blindly treat something on just external symptoms that we're seeing. We want to do evidence-based medicine." Okay, so you need to show them, okay, look, these liver values are high, which is why we are going to start this treatment, and about 80% of our clients do agree to do a lot of these tests. So just talking to them, explaining to them why you want to do it is very important. Another very important thing is know the species that is coming to you, or use Google. It's there's no there's no harm in it. Please use Google to at least know the species you're treating. And if it is Indian wildlife, please inform the owner about the Wildlife Protection Act. Give them the option of submitting that animal to the forest department, because that's where it can at least get rehabilitated and have a chance at survival. A lot of the problems that we're going to talk about are husbandry based, because people know how to keep these don't know how to keep these animals, and a lot of them suffer because of it. So if we kind of stop it at source, start educating your clients right away. Okay, this is Indian wildlife and we need to protect it by getting them, by buying them. Of course, you're uh, promoting the illegal trade in Indian wildlife, but you're also trying. I mean, you're propagating something that is just not right. Uh, it's illegal as well, but of course, our laws aren't that stringent. But still, you can put the fear of the law in them as well. All right. So educate your clients. If a client about I've got about, I would say, 70% success with people ready to submit their animals to us or to the wildlife NGO for rehabilitation and release, and it's not been bad, of course. But you also need to consider that if a person has had a bird for 40 years, that bird is not fit for rehab, and if you take it away from the environment it's been in, it's going to stress it. So it's a slippery slope there. Yeah, so we need to think about that when we come to it. All right. So let's get to the clinical aspect. Okay, I've changed my slide. Can you see the new slide?
Yes, ma'am. It's visible.
All right. So first, I think the most
Ma'am,
common
can you open your
condition,
PPT on the full screen mode?
it is on the full screen mode. Can you see it?
It's not on full screen mode, ma'am.
Oh God. Now?
No.
Is it?
No, but it's visible.
Hey, but I'm putting it on full screen. Why isn't it becoming full screen? Is it full screen now?
No, ma'am.
God, what is wrong with this? Is Google Meets. Where is this?
Someone is saying press F11.
F11. Okay.
Ritik, it's not working. But it's
Because it's
okay.
full
It is
screen on my
visible,
screen.
but it's not working.
Okay, can you see it now? Okay, let me just share it again.
Yeah.
Just gonna share this. Okay, can you see this now?
Yeah, it's visible.
Is it on full screen?
Yeah, it's on full screen.
Thank you, ma'am.
All right, no worries. Okay, so we're talking about metabolic bone disease. Okay, this is something you will see in almost every captive Chelonian that comes. Almost, yeah, almost every. I don't remember seeing a patient and being like, oh, your bones are healthy. So basically, it's a calcium deficiency. Okay, that's a very basic form, and that is how we explain it to the owners that your turtle or tortoise has a calcium deficiency. Now, what leads to this deficiency? Okay, can we have some answers here? What do you think might cause this deficiency?
Low calcium levels, basically.
Yeah, of course, it's
Improper
a
food.
calcium deficiency, so of course.
Improper food intake, I guess. Like
Okay.
the nutrients are not provided the way they should be.
Okay, so poor nutritional, like the food given is not right. What else?
Someone is saying improper UV rays, I guess.
Yeah. So, which kind of UV rays do they need to make calcium?
Mm, I don't know. So,
Okay, so they need UVB radiation usually, which comes from the sun. So UVB rays again help in the absorption of vitamin D. Vitamin D helps in the absorption of calcium, etc., etc. So that is the whole sequence of events as it goes. Okay, so this Indian star tortoise that you see on screen has been like this for about 10 years. And this is, in this case, this condition is irreversible. As you can see that the legs are completely bent.
hmm.
Okay, their shape, they're completely out of shape. The shell has severe pyramiding also, and the shell shape is of course abnormal. It's not a nice round shell, a hard shell, and it was very spongy and soft. So metabolic bone disease, it basically, what happens is, to function, of course you need calcium and phosphorus in your body to function. So to use that, the body starts taking out the calcium from the bones. Okay, that's the job of the parath hormone from the parathyroid gland. So that sucks out the calcium from the bones to use in the body, and then slowly, slowly, the calcium starts leaching out of the bones, and it leads to conditions like this. Now, the treatment for this, what is the most obvious thing that you would do?
UVB radiation, it is deficiency of that. So maybe sunlight, putting them on sunlight and their
Okay,
diet,
sun
or maybe
diet. Mhm.
supplements. Someone did say you should give calcium supplements.
Calcium supplements, yes. So a lot of these patients, when they come to us, are not eating at all, and they haven't been eating for a month, and that's when people think it's a problem, because they think it's normal if their tortoise or turtle doesn't eat for a month, which is actually not true. Okay, they need to eat at regular intervals. They need to pass urine, stool, urates, etc. at regular intervals. Red-eared sliders in India do not hibernate. Indian star tortoises do not hibernate. So no, if your turtle is sleeping in a corner for a month, it's probably dead. All right. So no, they do not hibernate here. Um, so what we would start, of course, is we first correct the dehydration. We start giving calcium injectably initially. We give calcium gluconate at about, it can go from 50 to 100 mg per kg. All right. So we start giving that intracelomically or subcutaneously with warmed up fluids, either RL, DNS, or both. And then we also in certain cases would give a shot of vitamin D. Again, you can overdose with vitamin D, so you need to be very particular about this dosing, and the dosing would probably be once in a week or once in 2 weeks. But again, then you need to start correcting husbandry. They need UVB light. You get UVB bulbs on Amazon. When you recommend UVB bulbs, you also need to tell people that they need to replace these bulbs every 6 months, because the UVB power of the bulb reduces, okay, after 6 months, and you won't be getting the right amount of UVB rays. So the bulb needs to be replaced every 6 months. Morning sunlight is the best time. So like between 7 and 10 o'clock, the sunlight is the best time to get UVB rays, which is why people say you should walk in the morning sun to get vitamin D, etc. Okay, so yes, that is important for these reptiles as well. I'm just going to show you. This is like a textbook image of what happens and how calcium is absorbed and how the parathormone works. I will share this with you all because this is I mean, it's just basically it's theory. All right. So how UVB radiation works and helps in the absorption of vitamin D, which in turn helps in the absorption of calcium. All right. I've changed my slide. Can you see that?
Yeah, it's visible. We can see it.
All right. Can you see these images?
Yes, ma'am.
Okay, so the first image on top is of a red-eared slider. What's the first obvious thing that strikes you?
It has red stripes on his eye, on its side.
Okay. What's the what else?
The arms, I guess.
Okay, what else? There's something hanging off its face. Can you see that?
Someone is saying overgrown beak.
Yes, exactly. Can you see my mouse?
Uh-huh.
Yeah, so can you see this is the overgrown beak here?
Yeah.
This is not normal. If you look at the Indian star below, can you see the overgrown beak here, the lower beak?
Yeah, it is quite visible in this one.
Yes. So this is an overgrown beak in a red-eared slider. Again, we had to trim this beak. We burr it down, okay? And even in this case, but this case is very, very extreme and very, very hard to reverse these kind of cases. It's very sad that these reptiles have to go through this because people want to keep them for fun. All right. Now, again, why the importance of X-rays? Can anyone help me with this X-ray? It's of an Indian star. It's actually of this guy only. What do you see? Anyone? Okay. I'll just give you X-ray basics here. This is the stomach. Okay. These are the intestines here. It's all gas in the intestine because I hadn't eaten, of course, in months. Now, if you look at the bones in the legs, can you see that the bones are actually barely visible?
Yeah, it's not
Okay,
visible.
even in the forelimbs, the bones are
Mhm.
barely visible. Okay, this is
Yes.
because there is a low bone density. Okay, this is another diagnostic tool that tells you that there is metabolic bone disease because the bone density is very, very low. Okay, you can barely see the bones in the X-ray because most of the calcium has been sucked out of these bones. There's another finding in this X-ray which I don't know if I'm just highlighting. Can you look? There's something around the joints in the hind limbs. What could that possibly be?
I don't know. I
So
think
yeah. So you know that reptiles excrete urates.
hmm,
Okay, so these are urate crystals. Okay, this is gout. Okay, this
in the
is
joint.
because yes, there is urate crystal deposition in the joints. Gout is also very commonly seen in captive reptiles. Okay, so this tortoise also had gout because of impaired renal function, again, because of poor nutrition, because of poor husbandry. The kidneys were also failing. So there was no, like, and they also sometimes, if you have a high protein diet, like a lot of people sometimes feed these tortoises paneer, they give them chicken, they give them like random food. Okay, so this causes the deposition of these uric acid crystals in the joints. It's a very painful condition. All right. Any questions?
So far, I don't think so.
All right. Okay, let's move on to prolapse. I think something that we see often again is cloacal prolapses. Now, to identify the organ that has prolapsed is very important because if it is a phallus, I mean, you need to know whether it's a male or a female. So, if it is a phallus, um, yes, it is. You can amputate it in most cases. If it's necrosed, yes, you can amputate a phallus, and the only thing that will be impaired is the reproductive function in that turtle or tortoise. Okay, but you also need to check the viability of this organ before you decide to cut it. Okay, if the organ is viable, please push it back in, and so we'll come to it. How are we going to reduce the edema? Usually, when an organ is pushed out through a small opening, it does get slightly strangulated. It does get edematous. So, how have you all? What do you think? How do we reduce edema in these tissues? I mean, it's similar to dogs and cats.
Someone is saying concentrated sugar solution.
Yes, that's absolutely right. We use that very often. We just basically actually sprinkle, not even solution, we sprinkle, we just like basically coat it with sugar till all the liquid is out. And then we push it back in. So, of course, this works on the principle of osmosis, which you all should have learned probably in the 10th standard. Okay.
Mhm.
So, it sucks out the water from the tissue, makes it shrivel up so it can be pushed back in. Now, one drawback of using sugar solution is that it is a great breeding ground for bacteria. Okay, so when we do use it, we need to also put um, the animal on antibiotics so that they don't catch an infection. All right. Otherwise, there's going to be sepsis and the patient will go into septic shock. So there should be good pain management and there should be a good antibiotic cover. Okay, so what we normally use is either enrofloxacin, okay, which is something we commonly use in birds and reptiles. So in turtles, tortoises, we do it at 5 mg per kg, either every 24 or every 48 hours, depending on the size and the condition of the animal. Okay, so once you push the organ back in, you need to take either purse string sutures around that. Again, your purse string suture, you need to have a gap for urine and stool to come out, but not a gap big enough for your organ to prolapse out again. Okay, and you need either or you suture the edges. I'll show you an image of how we've sutured the edges as we go ahead. So that is something that we see pretty regularly, especially during the mating season, which is around now, uh, summer to monsoon, kind of the transition is their mating season. So either they do that when they are sexually frustrated and they start pushing the phallus out, or in females when there's egg binding and there's training to pass the eggs out, they have an oviductal prolapse or an intestinal prolapse. So it's important for you to first identify the organ, and you need to know whether your reptile is male or female. In this case, this is a phallus. Okay, that's a male, and we amputated this one because it was completely necrosed. Okay, we're gonna go next. Okay, any guesses? What's this organ? Anything? Any guesses?
Rectum.
Okay, close. It's actually the colon. Okay, but it's very very edematous. Okay, so again we uh, threw sugar on it, reduced it, pushed it back in, and took sutures around the cloaca. Okay, all right. What are these now? Oh, and also in all these cases where we do suture, the animal has to be under anesthesia. Huh? These animals are not awake.
Mm.
Okay, what is this organ? Okay, both of these are phalluses. Okay, it's the penis. So
Okay.
the both of these organs are viable, huh? I didn't amputate these. So in this case, you can see like we just freshened up the tissue and we've pushed it back in. Even here, we pushed it back in, and there are two sutures, one here and one here. Okay, that's taken on the edges of the cloaca because there wasn't enough space to do a purse string. Okay, and
Yes, ma'am.
again, they have to be covered with antibiotics and painkillers. Pain management is extremely important. We normally use meloxicam at 0.2 mg per kg once a day. And again, we give it with fluids. Even when you're giving and when you're giving enrofloxacin, never give it just by itself. Always dilute it with either DNS or RL because it's a very painful injection and it can cause tissue necrosis when where you inject it. Okay, so be very mindful of that. All right. Okay, can you see this slide now? We're talking about abscesses.
Yes, ma'am.
Okay, what is an abscess? Simple.
Swelling.
A swelling of what? What would you expect to find inside an abscess?
Pus.
Yeah. So basically, an abscess is a collection of white blood cells, okay? Dead white blood cells, which is pus. And usually in reptiles, we would find caseated pus, okay? Which is like thick, hard pus that we would find. So this is a red-eared slider with a ear abscess, okay? It's an oral abscess. Now, these abscesses will not usually burst on their own, okay? If you do warm fermentation, etc., uh, nothing. It will not burst on its own, okay? Because it's caseated pus. So, again, we need to anesthetize the patient and we need to cut open this abscess and we need to remove this pus. And ideally, I would send this pus for culture and sensitivity so that I know which antibiotic to use, which I think should be a norm with most of our patients, whether it's dogs, cats, birds, anything. If you want to start an antibiotic for an infection, I would ideally do a culture sensitivity. But if your patient is critical again and it needs the antibiotic, yes, you can start with a broad spectrum till you get the result of your culture sensitivity back. All right, so we would either we would start with again enrofloxacin, or you could even start with ceftazidime, which we use in turtles, tortoises pretty regularly as well. Ceftazidime we normally do at around 20 mg per kg every 72 hours. Okay. Again, I would like to dilute any of these antibiotics and then give them because they are painful injections. So it would be subcutaneous or intracelomic. All right. So this is a red-eared slider who had come in with a complaint of swelling near the hind legs. Okay, can you see this swelling?
Yes, ma'am.
Oops, I zoomed in. Yeah. Okay, I'm just gonna play a video for you. Let me know if you can see it.
Yeah, we can see.
Yeah, that was a fun moment of abscess popping. Okay, again, this turtle is sedated, huh? Okay, I'm just gonna play that video again because the popping went by pretty fast. Whoops, my bad. Yeah, there. Okay, so there were two huge caseated masses there. Okay,
Uh,
these are both. This is pus. Okay,
sorry to interrupt you, ma'am, but
sure.
I think Neha has a question she has raised in her hand.
Yes, yes, Neha.
The question is, what is the sedation protocol used for these turtles?
Okay. Um. So normally, if we were to do a procedure like this, I would need light sedation because it's not a very invasive procedure. So I normally use ketamine and midazolam. So midazolam at about 1 to 2 mg per kg. Yes, it is higher than what we do for dogs and cats. And ketamine at about 15 mg per kg is what I use. And I give it intramuscularly and then keep them in a warm in my incubator because if your reptile is not at its right temperature, your sedation is not going to work because it won't metabolize it. Okay. And then I also use local anesthesia around the area where I'm going to cut. Okay, so just local infiltration there with a little bit of lignocaine. So that's for these kind of abscesses. Okay, if it's a minor procedure, we would go um, and for if it's like a major surgery, again we would then intubate and start isoflurane as well. Okay, but this one was just a minor procedure, so the sedation was pretty light. Neha, I hope that answers your question.
Yes, ma'am. Thank you.
Okay. How many of us now regularly we see turtles that come into the clinic, say with swollen eyes? Okay. What comes to your mind when you see a turtle with swollen eyes? Like what would you normally think it is?
Irritation, infection, deficiency of
Mm-hmm.
um,
Deficiency of
vitamin A, I guess.
vitamin A deficiency. Okay.
And
Okay. So any sick turtle will have closed and swollen eyes,
hmm,
even if however it's sick, which is why it's showing this. So the swollen eyes can be anything. It can be anything, and to diagnose it you need your diagnostics. Okay, you need your X-rays, you need husbandry, you need good history, you need to know what's happening there. Okay, because it's not always a vitamin A deficiency. And especially in tortoises, I've seen a lot of tortoises being given vitamin A shots when they don't need them. Okay, tortoises very rarely get vitamin A deficiencies. Red-eared sliders, yes, they do get it more commonly, but you need to rule out and you need to actually know whether it is a vitamin A deficiency before administering vitamin A, because hypervitaminosis A is also bad. Okay, there is skin sloughing. They're going to start losing, the skin basically like just starts coming off the body, and it's not a very great condition. So you can overdose a turtle with vitamin A. So be very, very careful when you're administering vitamin A and make sure that it does have a vitamin A deficiency before you administer vitamin A. So I usually, if I use vitamin A, give it at 2000 IU per kg, either intramuscularly or orally. Okay. So anorexia, again, most of your turtles who are sick will come to you with anorexia. Okay, so anorexia is not a condition, it's a symptom of something. So a turtle not eating can be a million things. So again, you need to run diagnostics, you need to check the history, you need to check the husbandry. Now, usually the smaller red-eared sliders, the new, when they're just bought from the stores and they come with these conditions, it's usually not a vitamin A deficiency. Okay, it's always about, I would say 80% of the time it is a respiratory infection. Okay, even when they have a respiratory infection, their eyes swell up and you'll see open mouth breathing, there will be nasal discharge. And then when you ask questions like where is it kept, it's kept in a tub of water. Does it have a dry area to come out on? No, it doesn't. Does it get UVB light? No, it doesn't. Does it get sunlight? No, it doesn't. Is it kept in the AC? Yes, because it's kept in my room and the tank or tub or bucket or wherever is kept is in the AC. There you have it, and that is usually the cause of your pneumonia in most turtles. It's the poor temperature. Okay, you need to maintain the temperature of these reptiles. They're very, very particular about their temperature ranges. So I like to keep them at a nice warm 28 to 30 degrees. When people set up their tanks, when they come to us, we tell them how to set up a tank. We ask them to get aquarium heaters, which are easily available on Amazon or any of these aquarium shops. You'll get an aquarium heater which keeps the water warm. Okay, so you don't need to bother about changing the water, putting warm water to keep it warm, because it's going to keep the water temperature constant. And at one end of your tank there has to be a UVB light and a basking area, so that if the turtle wants to get warmer, the basking area is usually at about 35 degrees. Okay, it's nice and warm, and they like to sit under it when they want to be warm. Once they're done, they need to have the option of going back into the water when they're done. And that is something that has to be decided by the reptile, not by the owner, because they don't know when it wants to be warm and when it wants a cooler environment. All right.
yes,
And
ma'am.
a lot of people
Um,
will keep them in, Yeah,
There's a question, ma'am,
yeah.
and the question is how to check the vitamin A level.
So we unfortunately don't have the test. Like we don't have. We can check serum levels of vitamin A, but we don't have the test kits available for reptiles. So normally, again, I would go with the husbandry. When you have a vitamin A deficiency, yes, the eyes will be swollen, but you'll also notice that the owners are usually feeding these animals just freeze dried worms. uh, just that and nothing else. And usually these are the ones that have the vitamin A or deficiency, or they're feeding dried fish, the sukat fish that comes zawla and all that. That's a very Maharashtrian thing actually. Like dried salted fish, and that also causes deficiencies. So if your diet is incorrect, yes, you can suspect a vitamin A deficiency. um, Usually husband related issues are not vitamin A deficiency, it's usually dietary related. So if your turtle is getting a good amount of veggies, fruits, meat, and turtle food, okay, not only turtle food but a mix of all these things, vitamin A deficiency would be low on my diagnostic list. uh, Again, then temperature, if I would ask them about where it's kept, you need to ask them. You actually really need to get into their lives, okay? You need to ask them what they do you smoke around the turtle, do you smoke around the bird? That's another thing that's important in birds. So you really need to get to, like, it's an interrogation literally, but you need to ask very pointed questions to get to know what is actually going on with the patient. And yeah, but we don't really have a blood test right now to check for vitamin A levels. Maybe at some point we will. um
Yes, ma'am.
so
Ma'am,
it's more of a symptomatic thing. Huh.
Nihal is asking what homemade diet we can give to turtles, especially the red-eared slider turtle.
So homemade, that's what you need, like a mixture of veg. And again, it's age related. If your turtle is less than 5 years, like if it's small and if it's juvenile, they would eat more meat. They need more protein in their diet to grow. So there would be boiled chicken, prawns. Uh, I also give turtles live worms, like those big fat earthworms. They like to eat those as well. That's a treat though, not every day. You can even give them live guppies. They like to chase them around the tank and eat them, so that even gives them some exercise. Um, then I would add veggies. So they like to eat grated carrots, corn,
Hmm.
capsicum, um, coriander. But this has to be a mix, okay, of veggies. Not, and they love colors. So if you give a wide range of colorful vegetables, pumpkin they like to eat, and fruits as a treat once in a while. So apples, watermelon would be a treat once in a while. Okay, so and yes, turtle food along with this. And
Thank you,
when
ma'am.
you clean the tank, you need to ask also how often people are cleaning the water in the tank. Because if they don't have a filter, ideally you would clean the tank every day if you don't have a filter. And or else what you would, I advise people, is to have a separate feeding tank for turtles. You feed them in one tank, and once they're done feeding, you put them back, so it keeps the water cleaner for longer. And also a lot of bacteria grows on the food that's left in the tank, so that needs to be cleaned up immediately, otherwise it's a source of infection. Yeah. Are there any other questions?
No, ma'am. That's all.
Okay. Also, soaking in carrot juice is not going to cure your turtle of anything. Okay, it's just going to get marinated in some carrot juice. It'll turn orange maybe because of the color. That's all, but nothing is going to happen if you soak a turtle in carrot juice. All right. So again, this is an Indian roof turtle. You can see that I've changed the slide, no?
Yes, ma'am.
All right. So this is an Indian roof turtle again. This one was kept in a terrible condition. You can see that the skin is actually peeling. The eyes are swollen, and it was basically the shell was covered in uh, algae and moss, and it was very disgusting. So yeah, so what we did is we cleaned this one up. We sort of brushed the shell and cleaned it up, gave it fluids, gave it antibiotics, and it took about a month to get it back to eating. Okay, but this one did not have a vitamin A deficiency. Nope. Now this red eared slider, okay, can you see basically what is up with it? Like what can you see by face value?
Edema.
Yes.
Someone is saying MBD.
MBD, yes.
Um,
Okay. Also, this turtle is very obese. It's
hmm.
fat that and it's oozing out of its shell because its shell has not grown in proportion with its body because of poor nutrition. Okay. This one also has swollen eyes, but this is not a vitamin A deficiency. This is edema because he had fatty liver. Okay, fatty liver because of an incorrect diet and yeah, overfeeding, of course. So this one had a fatty liver, okay, and not a vitamin A deficiency. Okay, let's move on. Okay, we're moving on to egg binding. Are there any questions about swollen eyes or um, any husbandry related questions at all?
Uh, there's a question, ma'am. What was the fatty
Yeah.
liver turtle fat? What was the fatty
What
liver
is the
turtle
fatty?
fat? Fatty
It
liver
was
turtle fat.
it was fed pretty much everything they had in the house. So from bread to chapati, rice, everything, popcorn, everything,
Popcorn.
and a lot of and overfed the turtle food as well. So that's what when you have an adult turtle, a red-eared slider as well, they don't feed every day. So once actually they cross 5 6 years of age, I ask people to reduce the food because their metabolic needs reduce with time, with their age, because they don't need that much calories, they don't need that much protein because their growth is done. Now they basically need it for maintenance. And in reptiles, the metabolic rate is anyway very slow. So you don't need to really supplement them with that much food. And they're honestly in captivity, they're not burning those calories anywhere. Okay, they're like probably swimming around in like a 3 by 4 tank, or a lot of them in buckets, okay, where they don't even get to swim really. So yeah, so their energy requirements are very low as they age. So in older ones, especially once they cross 10 years of age, I advise people to feed them on alternate days, not every day. Okay, when they're tiny, like the coin sized turtles, yes, they eat about twice a day. And as they grow, you need to start reducing the frequency of the feedings. Okay, and yes, these guys will eat as much food as you give them, so they're not going to stop eating. So you need to really be very particular with how much you're feeding them. Usually by thumb of rule, we go at 10% of the body weight. So if my turtle is 500 grams, I would feed it about 50 grams in a day. And as it ages, I would make that on alternate days. Okay, 50 grams is also a bit much for me. I would probably give lesser than that, probably half of that. Yeah, just to because they're not burning that much. Yeah.
Yes, ma'am.
All right. So let's move on to egg binding. You let me know if I'm going over my time, huh?
Oh, it's okay.
All right. And if y'all are getting bored, also tell me if you need a break or something.
No, we're not. It's actually very enlightening and it's fun.
All right. So we have egg binding. Okay, egg binding you see in birds and reptiles because they are egg laying creatures. Okay, so usually in captivity, the causes of egg binding are mostly environmental and nutritional. Environmental because they don't have the right environmental needs, that they're not given the right environment to lay those eggs, and nutritional because a lot of them have nutritional deficiencies like calcium deficiencies. So they do, like, they don't have enough calcium to lay those eggs. They don't have it in their muscles and their sphincters to actually push those eggs out, and the eggs also kind of suck out the calcium again from the bones, and which again will lead to metabolic bone disease. Okay, which is, that's why it was my number one slide, because it's a very very important condition we see. Now, any guesses of whose like follicles or eggs these are? Any guess? Random guess.
Um, Iguana, Indian star
Yeah, it is. It
tortoise.
is. No, it's an iguana. You can see the scales over here. See, just underneath there. These are iguana eggs. So this is literally, actually, we was paying an iguana because she had follicular stasis. Okay, so iguanas do especially face this condition. So we do usually advise people to get their iguanas spayed, and not wait very long till they reach a stage of follicular stasis. Okay, uh, so what is the right environment you would give a bird? Let's come to birds. What kind of environment would a bird need to lay eggs? Like, what's a basic thing that even a baby would know? Like, where does a bird lay eggs?
Calm environment.
Like,
Suture.
where would want to
In
lay
the
eggs?
nest. In the nest.
In a nest.
Oh.
Yeah. So usually you need to have a nesting area. If you have a female bird, uh, so she needs a nesting area to lay that egg. If you don't want your female bird to lay eggs, you need to again not stimulate that bird enough to lay those eggs. So it's a very, this is getting into a lot of detail. Okay, let's see, how do I simplify this? So birds will lay eggs also depending on the length of the day, and it's seasonal. Okay, so if you give a bird that it's their egg laying season, if you give them shorter daylight hours, they will not lay eggs, as in they won't form the eggs, because their brain system, the whole hormonal system will tell them that it's not time to lay eggs, so they won't make the eggs. That is how usually we stop female birds from laying eggs. You know that, of course, birds and reptiles make infertile eggs. They do not need to mate to lay eggs. Okay, and egg binding usually does happen in birds that are usually alone, and most of these eggs, of course, are infertile. Okay, and the binding again happens. The egg binding is when they're unable to lay those eggs because they don't have the right environment. If she had a nest box, yes, she would go in the nest box and lay the eggs. Nutritional, not enough nutrition or energy to lay those eggs, or the eggs are malformed because of the calcium deficiency, so they're unable to lay the eggs. Okay, uh, for turtles and tortoises, say for Indian star tortoises, again they are also seasonal egg layers. This is actually the season for them to lay eggs, when it's very humid and it's hot. They like to lay eggs when it's raining, because that moistens the mud when they dig. to lay the eggs in the wild. So the rain kind of stimulates that egg production. So the production of the eggs will start before um, the rainy season, and usually once it gets more humid and moist around this time, like the end of May, June, when it's just about to start raining, is when they lay those eggs normally. Okay, so this is the season where I would get a lot of egg binding cases. And how do I know that there is egg binding? What do you think the symptoms would be?
The eggs are stick together.
How do you know that
Was the
there are eggs? It's I mean, my favorite
no?
diagnostic tool. Just take an X-ray.
Yeah, enlarged abdomen, less
Enlarged
appetite.
abdomen, not really. You won't really see, like, they don't really, you can't see, they don't look pregnant. Not like mammals. So in
Inappetence.
reptiles, inhabitants, yes, they stop eating because
Hmm.
the eggs and the follicles take up so much space in the coelom that it pushes against the organs. Okay, so they don't have space to take in the food. So it is normal in the wild for the females to go off food for a couple of days just before they're about to lay the eggs. Okay, so I wouldn't worry if this female was in the wild, but these females are in captivity, so yes, it bothers me. So initially, I'm not going to try and take the eggs out, okay, right away. We're going to try and let um, the turtle or tortoise lay the eggs on its own. So again, we make an environment for them. I tell people to sort of spray warm water on them so they feel like it's raining. Give them a tub full of mud to dig. You know, so you need to just start doing that, warm up the environment, let them do that. That sort of stimulates them. And I also start giving them fluids, as in either RL and DNS. Plus I also add calcium because there is a high demand for calcium from the body at that time. So I also inject them with calcium, and that sort of helps them to start contracting and lay the eggs. But I do this for a week. If beyond a week I repeat the X-ray and I see that the eggs haven't moved from their positions at all, I will induce. Okay, now we induce usually with oxytocin. Again, when you're inducing with oxytocin, you need to make sure you're maintaining the hydration and the calcium levels. Okay, because calcium is important in contractions also. Okay, it's a very important mineral in the body. So I would induce with oxytocin. So we start, so the dose goes from 1 to 5 IU per kg. So you start at 1, okay? It's a whole day's process, okay? No contractions, nothing. After an hour, I will increase it to 2. Then slowly over a few hours, I will start increasing the dose till the female has laid the eggs. If even after the oxytocin induction, she is unable to lay the eggs, there is most likely either the eggs are stuck, there are adhesions, okay, and there is dystocia. So this turtle will most likely need surgery. Okay, so we would then start planning for surgery to remove the eggs. Now, for birds, uh, budgies and cockatiels is where I see egg binding more rampantly than in other cetaceans, I would say. Okay, so actually even in finches, if you go to passerines. So yeah, usually the smaller birds is where you see more because they tend to lay more eggs. Also, they reproduce pretty frequently, and people do tend to give them nest boxes in the house, and there are like at least suddenly I had a patient who came to me I'm sorry, with two African lovebirds. And she said, this bird keeps going into the nest box. I don't think she's well because she just wants to, like, she's just staying there alone. She's not coming out to eat and stuff. So I asked them to bring the entire cage and everything here to the clinic. We looked inside. There were actually two chicks, and the owner didn't even know when she had laid eggs and when the eggs had hatched. Okay, so there were two chicks inside the nest box. So yeah, people don't realize the birds also do it very quietly. So now they have four birds instead of two. So that is, so you need to be very observant, especially if you're giving them a nest box. You need to be very observant, and you need to give them at least a calcium block, etc., to get a source of calcium while they are uh, in the egg laying phase. Okay. If now a bird comes to me, she's egg bound. Okay, we know she's egg bound because I've actually palpated the abdomen. I can feel an egg. I've done an X-ray and there is an egg. It's in position. Okay, but the bird is extremely dull. She can barely stand. I'm not going to try and remove the egg when she's in that condition. Okay, first we will stabilize her. We'll put her in an oxygen chamber. So little stable, give her some fluids, okay, either IV or subcutaneously, depending on how handleable the bird is. And then sometimes if the egg is low enough, even with mild digital pressure, slowly you can ease the egg out of the cloaca. Okay, don't again try this if the bird is extremely dull. And usually we would like to do this under sedation depending on the health of the bird. Okay, so uh, doing it under sedation would be best. Okay, so slowly manipulate and get the egg out. If the egg is abnormal, then in a lot of cases sometimes we need to break the egg inside. Now this cannot be done without anesthesia. Okay, and then remove the pieces, suck out the yolk, and then remove the remaining pieces. Again, if you burst the egg inside and don't remove it or don't clean out the coelom, there is going to be egg yolk peritonitis, and that is a very critical condition, and you can lose the bird there. Okay, so what do you see in the X-ray of this iguana? Okay, this is an iguana. Okay, I told you that. What do you see in this X-ray? Anyone?
Eggs.
Where are they? How do you know there are eggs? There's a picture of eggs next to it. So yeah.
The follicles are occupying a major part of the abdomen.
Yeah. So can you see these bumps just under the lungs? There are these round bumps here. Can you see this?
Yes, ma'am.
You can see my mouse, right? Can you see my cursor?
Yes, ma'am.
Yeah. So these are all the follicles. And she hadn't been eating. She was quite dull. So we did X-rays, we did blood tests, and we saw that she had follicular stasis. And so we had to take her in for surgery, and we removed her follicles. Now she's basically spayed, and she's doing quite well. Okay. Any questions about egg binding?
There's a question, ma'am. Can you please tell again the oxytocin protocol?
So oxytocin, I would normally do from 1 to 5 IU per kg. And I would initially start at 1, and it goes intramuscularly. And then every hour I would increase the dose. So from 1 to 5, I would increase it every hour till the eggs are laid. But I would wait, give them a warm environment, give them a nice humid spray baths to sort of stimulate the contractions, and that's how we would proceed. Okay, any other questions about egg binding?
No, ma'am.
Okay. Now, especially in Bombay, in the cities, we see a lot of rats, and we've recently, not recently, it's been a while since we've seen that, uh, Chilonians seem to be their new favorite snack, and at least every year, I get at least 20 rat bite cases. Okay, and some of them are pretty bad. So this was the image that you see is uh, an Indian star tortoise whose shell was completely eaten up in front by a rat. Okay, so initially when that patient comes to you, um, first, of course, control any active bleeding. Okay, with pressure. Then you have uh, botropase. You can put a drop of adrenaline and put pressure on the vessels that are bleeding. Okay. Do not ever put haldi on any wounds. It's only going to contaminate the wound and make it worse. Okay. Then, of course, once you've controlled the bleeding, you have to do pain management with meloxicam. You can even use buprenorphine. Buprenorphine will make them drowsy, but it does help with the pain depending on the severity of the pain. And since they will have lost blood, they will be in shock. So, of course, fluid therapy, RL, DNS, and antibiotics, because rat saliva contains a lot of uh, bacteria. So yes, cover them with antibiotics. Ceftazidime is a good one. Along, you can use ceftazidime and uh, ceftazidime and enrofloxacin. And I also like to topically apply metronidazole on the wound also. Okay, and you need to do X-rays to check for any internal damage, because this is what you see. There might be more damage internally. Okay. So you can see how this tortoise, sorry, healed over a span of 6 weeks. Okay, this is the same tortoise in the previous slide. This is how it was. The wound was completely bitten and open, and then we started having some good granulation tissue, and then eventually it became like this. So I kept this wound covered, and we were changing the bandage every 2 days. So on alternate days when they would come for their antibiotic shots is when we would change the bandage. So in this one we had topically applied placentrix and metrogel gel, and cleaned it and freshened the wound, of course, with betadine first, and then applied, and also Silverex. That's silver nitrate. Yeah, that also works quite well and helps with tissue healing. These again are a few rat bite cases, as you can see. Okay, that this one, the red earth slider, pretty much looked like Michael Jackson because its nose was bitten off. They do survive this, and they do quite well once the wound has healed. But yeah, again, he just looked a little strange, but he was fine later. This one was a pretty severe one, because you can actually see that it's reached the coelom and almost entered the coelomic cavity here from the back. So this one we really needed to cover with great antibiotics and keep it uh, very, very clean and dry. This red earth slider, again, you can see that the limbs here are bitten. This one was marinated by the owners in haldi. So, firstly, we had to sit and scrub off all the haldi and only then treat the wounds. Oh, okay. I think my slide has moved around here. Let me just clean that up. Yes. Okay. Now we'll talk about shell repair. Any questions about rat bites? You will see a lot of rat bites. Basically, and also wounds. So this is how you generally treat wounds. All right, let's move
No.
on to shell repair. So shells usually get fractured or broken when tortoises fall from great heights, which happens more often than you can think. They fall from the window. I don't even know how that happens, but we've had turtles falling from the sixth floor, 12th floor, third floor. It's been a mess. Okay, this one, I think also people sometimes step on them, and they step on them quite hard, so the shell cracks. uh, so of course in these conditions you need to stabilize because they will be in shock. You need to give them pain medications, you need to keep them warm before you start doing your other stuff. Take x-rays to see what else is broken, check for internal bleeding. Okay, and when you put a shell together, it needs to be stable like that for at least 6 weeks till the healing starts. Okay, so this kind of a broken shell, I would freshen up these edges, because usually they also come in about 2-3 days late once it's already infected and bad. So you freshen up the edges. Again, this is all done under sedation. Okay, so freshen up the edges, clean up the wound, bring the edges together, and you can then use different ways to bring the edges together. So one example is this was done by Dr. Nidhi, who works at my clinic. So these are normal hooks that you find at any tailor, etc., for your clothes. And so these hooks are stuck onto the shell with epoxy. Okay, epoxy again is easily available in any hardware store. You just need to ask for araldite, which is actually the normal adhesive that is used in uh, plumbing and stuff like that. M-Seal also works really well in covering up shell wounds. Okay, it doesn't go into the wound, it will only go above near the edges of the wound so that the edges stick together. Okay, not inside the wound at all, not inside the edges ever. Okay, because that's just a source of contamination and the wound will not heal, and it's a source of toxins. Okay, so these hooks are then now pulled together. The edges of this shell are pulled together with this. This is actually suture. It's a silk suture that has been put onto this to bring the edges of the shell together. Okay, and wet wrap has also been put just so to give it the extra support. Okay, so this is one example of how we do shell repair. Usually it is, and we use a lot of wet wrap. So if my shell is cracked from the center, I would normally just use wet wrap to bring it together and then leave it like that. Now, if you have a red earth slider that needs to go back in the water, I would initially, at least for a week, not let it go in the water. But then I would use something like M-Seal again, or like araldite, which is waterproof. And then slowly, as the wound heals, let them go in the water little by little. But if possible, I wouldn't let them go in the water at least for a month. Okay. Any questions? Because now we're moving on to birds.
No, I don't think there are any questions.
No? All right. Okay, what is this? What is this creature? What is this?
Parrot.
It's an Alexandrian parakeet. And what's wrong with it?
Overgrown beak.
Okay. It has an overgrown beak, but why?
Wrong diet.
Why? Everything is wrong diet. Like the answer to all the questions will be wrong diet, because most of the problems are caused by a wrong diet.
Someone is saying lack of trimming.
So what do they do in the wild then?
Um,
They don't have anyone to trim their beaks for them.
no hard substance to chew on. Lack of
Okay.
calcium.
Okay.
Um,
Okay. So this actually is a very clear indication of liver disease in birds when their beak overgrows. Is a very clear indication of liver disease. Okay, so this bird is actually 40 years old, and for 40 years his diet was, probably still is, bread and milk. So which is why his liver was completely damaged. He had hepatic lipidosis. So reversing it again and changing a diet of a bird that's been eating the same thing for 40 years is difficult, but not impossible if you try. But you have to convince the people who are taking care of this bird to do that. Okay. So we trimmed the beak, of course, so that he was able to eat. Their concern was his beak is overgrown, which is why he's not eating. Okay. And I had 100 other concerns, and I was like, the beak is like 1% of my concerns with what is wrong with this bird. Okay, but yeah, we can try and explain and hope for the best. So this happens usually when there is liver damage. Okay, this is a budgie. This image, what do you see in this budgie?
feathers are not, I think.
Okay, why are the feathers
Some
not there? Like, what is?
yellowish discoloration. Obese.
It's, yeah, it's definitely obese. Okay, so you see this thing hanging down here. That's actually fat. It's a lipoma. Okay, it's basically a growth of fat,
Excuse me, ma'am. I
and which
think
is actually commonly. Sorry.
there's a question. Someone raised his hand.
Huh. What's the question?
Then you want to ask a question? You raised your hand. Ma'am, I can't. He has not put his question in the box. You can move forward.
All right.
Maybe
No worries.
get
You
it.
can put it whenever,
Yeah.
and we'll get to that.
Yeah.
Okay. So usually with cetaceans, that's parakeets, parrots. Uh, People think their main source of food is seeds. Okay, which is a huge misconception. So you'll come, like, that's why we always tell people to bring the cage that they have at home with the bird, so that you know exactly what is going on, what they feed. Because once a patient came to me with a parakeet, and he was like, no, he eats fruits, vegetables, and at the bottom of his cage I saw a an actual lollipop that was at the bottom of the cage, and I was like, what is this? No, this I just gave him to play with during the travel. Okay, so people will lie to you, people will try to conveniently find an excuse for why their bird is sick when it's their fault. So you need to find out why. Okay, so if a bird is primarily eating seeds only, it's basically only eating fats. It's not getting any other uh, source of nutrition. Okay, because seeds basically contain fatty acids, and that's all it's getting. because birds need a balanced diet and seeds form only 10% of their diet. Normally what we see is 80% of their diet is seeds, and the rest, like there'll be a little bit of fruits and vegetables added to it. Okay, so seeds only form 10% of their diet, because otherwise it's going to lead to conditions like this. Now, birds in the wild usually eat whatever they want, because they also burn off those calories, because they spend half of their day foraging for food. So they're burning off those calories because they're flying around looking for food. So it's fine for them to eat that much seed, but in captivity they aren't going to burn those calories. They don't have a very busy day to say. Okay, so advise people about the importance of a balanced diet. Okay, only 10% seeds, the rest has to be fresh fruits, vegetables, and bird pellets. Okay, pellets are not seeds. Pellets are specialized food that is made for these parrots. Okay, so there are different companies that are available. Even in India, we get lots of bird food. Again, even that, the pellets only form about 30% of the diet. Okay, so it all has to be in balance. With again, when the vegetables also that you're giving need to be boiled a little bit before they give it. So, a seed based diet will again lead to fatty liver, obesity. And another telltale sign of liver disease is the darkening of the feathers. You usually see it on the wings. The ends of the feathers appear blackish. Okay. And you will see ascites, that is a swelling in the abdomen. Okay. So, not all swellings in the abdomen will indicate that there's an egg or that the bird is going to lay an egg. It can be ascites, which is why you need X-rays. So, what will you see in these X-rays? Okay, so this is just a basic bird X-ray. These are the lungs, the heart, air sacs, and the liver. So, how do you tell if the liver is enlarged? So, you would draw a line from the end of the heart, a straight line down to the liver. Okay, a straight line down to the liver. And if the edges of your liver fall outside those lines, then your liver is enlarged. Okay, so if you can see the X-ray on the right, this is of that budgie, by the way, the lipoma budgie that I showed you before. There is actually barely any space for the air sacs, which is why the bird could not breathe very well. Okay, he was pretty much gasping. And there is also, the liver is enlarged. There is also ascites, which is fluid buildup in the coelom. Okay, and this was all. And if you can see even these sides, this is all fat. Okay, this is all fat. So yes, obesity is a problem even in birds, especially captive birds. Any questions?
Not at the moment.
Okay, so how would we treat this? Number one, change of diet and husbandry. You need to inform people what they need to feed. Now you can't expect a bird that has been eating only seeds. Seeds is basically like eating junk food. It's an addiction. Okay, you can't expect a bird that has been eating seeds for years to suddenly switch to a healthier diet, because and they will go off food if you change a diet suddenly. So you need to very gradually do this over a period of 6 months. Okay, it takes 6 months for a bird to accept any new food, but it has to be done every day and consistently. So a it is a commitment on the side of the owner as well. Okay, to do this, to change the diet and to get the bird healthy. We will of course start it on liver supplements like silimarin. Okay, and we would also for ascites and things like that, we would put it on furosemide till the ascites has gone down, which is why they need to come back for regular X-rays and checkups. We will also again, if the bird is anorexic, we will give it fluids. um, uh, try to, sometimes we like to hospitalize them as in keep them at the clinic so that we can ourselves help to change the diet. That sort of hastens the process of the dietary change because they do eat mostly what we give them at the clinic. So uh, that does help to change the diet a fair bit if the owners are ready to hospitalize them. And again, this bird had trouble breathing because also there is no space, so the furosemide help the bird to breathe. If there are lung issues, if there's fluid in the lungs, etc., we also nebulize them. Okay, that helps a fair bit. All right, any questions?
No.
Okay. Now we come to feather plucking or feather disorders. Okay, feather plucking. What do you think would cause feather plucking in birds?
Stress,
Stress. Okay.
lack of enrichment,
Lack of enrichment. Yes.
ectoparasites like
Yes.
mites,
Yes. Mites.
viral disease like PBFT,
PBFT. Oh, okay. Okay. So feather plucking usually, of course, is it is a psychological condition, and it is also a medical condition. So to get to the bottom of what is causing the feather plucking, again, you need a good history, you need a good diet, and again, you need to take samples, you need to take X-rays. A bird who is in pain will also pluck its feathers. Okay, so if you find only one area of feathers plucked, it's possible there could be pain in that area, which is why the bird is picking at it, which is why only that area's feathers are plucked. If there's generalized feather plucking, most likely it is stress related, it's psychological. There is a lack of enrichment for these birds because these birds are very smart. They have an IQ of a 7-year-old child. So if you just leave them on their own without anything to do, they are going to self destruct. Okay, and another important cause of feather plucking, of course, ectoparasites, etc., but it's hormonal. Okay, in female birds, they pluck their feathers because they are sexually excited also at times, and then they are sexually frustrated. So when you speak to owners about how they interact with the bird, how where they touch the bird is also very important. Okay, especially with parrots. So this African grey, if you touch them on their head and their feet, that is perfectly fine because that is where friends would touch them. If you start touching their chest, the back, under the wings, okay, that is a place where only their mates touch them. So that sends the wrong signals to them, and this bird is going to get sexually frustrated and she's going to start plucking her feathers. Same thing for males as well. All right. So this bird came to me in this condition. It took us a year to get her to this condition. Okay. So all her feathers have come back. Again, after a year, the owner left to go abroad to study. She's plucked herself again and she's completely bald again. We had made this for her also. It's an e-collar, a very decorative e-collar because she liked to play with it. You need to give them something to play with, rather than it just being something that irritates them around the neck. So this is something colorful and you can even hang things on it so they are entertained and then they don't pluck their feathers. But so with this bird, it took us a year. We had to even give her antipsychotic drugs, etc., because she was very, very severely plucking, and we had got her to this level. But again, there was a trigger because the owner left. to go abroad to study, and she plucked herself raw again. So it's a very, very sad and a very frustrating condition. Okay, then we also did hormonal trials, which worked for some time. We gave her, basically, we give them contraceptives to stop the hormones. So that worked again for some time. And again, there was another trigger, and she started plucking again. So it's a condition that is sort of will have to be managed lifelong. There's no real cure for hormonal or psychological plucking. You have to constantly have the bird sort of like in therapy as we would with our mental health. So these are feather mites. These are eggs in the microscope, but these are what feather mites would look like, and that also causes a lot of itching and plucking. So you should always take samples to check under the microscope to check for mites, and we usually treat these mites with ivermectin, and the problem goes away pretty easily. All right. Any questions about feather plucking?
No, ma'am.
Okay. Now I'm almost done, guys. I'm sorry. These are like the this is what you all had asked for, so I've tried to put everything in one. Um, okay, so this is psittacosis caused by Chlamydia psittaci. We see this a lot in cockatiels, especially the cockatiels that are coming from Crawford Market. Usually, any bird that comes from Crawford Market, I like to test them for chlamydia. To test them for chlamydia, now we have labs that are doing PCRs. You can either send the stool or the blood sample. They prefer a stool sample because they say that the PCR is more accurate with the stool sample. So a stool sample would be great. You see bright yellow or yellow or green urates because yes, chlamydia does affect the liver. When you see yellow urates, it's just like how we see jaundice in mammals, okay, because that's the bilirubin, and the green is the biliverdin that is being secreted, that's coloring the urates. So you would also know that there is liver involvement in this particular disease. You see respiratory signs, okay, they're sneezing, eyes are swollen, they can't breathe very well, there's dyspnea. Usually when a bird is sitting and you just observe its tail when it's breathing, if the tail moves up and down, it's called tail bobbing. That's usually a sign of respiratory distress. Okay, so this is why you need to observe your patients from a distance before you go near them. Okay, so this is psittacosis. It is zoonotic. Okay, so if you have a bird that's tested for psittacosis, you need to be careful because this is a zoonotic disease which causes which causes fever. It causes respiratory signs even in humans. So you need to inform this to the owners as well. The treatment for this is doxycycline. Okay, we do it at 25 mg per kg twice a day for 45 days. Okay, because the bird continues to shed the bacteria even after the symptoms have stopped. Okay, again, for these birds, I would like to do X-rays also to check the liver involvement, to check the lungs, and nebulization helps a lot to clear out their breathing and clear out the respiratory tract. Okay, and then we have the PBFD. Okay, this is the cetacean beak and feather disease. This is very, 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 very common in Australia because they see it in almost every wild bird there. While I was studying there, every wild bird that we got was tested for this, and almost 80% of them were positive. It's a highly infectious virus. It's the cetacean circovirus, and we aren't getting too much of it in India, but we have started seeing it. Okay, so if there is a bird that has tested positive for PBFT or is it suspected for PBFT, it needs to be separated from the other birds ASAP. It cannot be kept with other birds because all the other birds will catch this virus very, very easily. It's either from the feather dust, it can be from any nasal discharge, it can be from the stool. Okay, so you need to be very, very careful about that. This is not zoonotic, so at least people that are handling the bird can handle it safely. Unfortunately, there is no cure for this virus. There is a vaccine that has been developed, but the success rate of the vaccine is still not very great. The birds may survive for a few months to a few years depending on their immunity. Okay, this virus causes leukopenia. So when you do a blood test, again, you can diagnose this issue when you know that it's a viral disease when there is leukopenia, especially with PBFD. And the feathers, again, you can see that the feathers have not grown very well on this cockatoo. Its beak is abnormal as well. The feather ends, like when you remove the feathers, they are clubbed. Okay, it's like a club shaped end. uh, so that is another telltale sign of PBFD. So this is one of my patients who did actually a long distance consult with did a long distance consult with us, but we had asked them to bring in the bird for testing. They had tested it for PBFD and it was positive, but then again, there is no treatment for this, unfortunately, and it's just managemental. So you can see how this is a gala, actually, I think. Yeah, I can't honestly tell because the feathers are just not. And you can even see the way its head twitching. Yeah, so this is unfortunately a very sad condition for these birds. Okay, we quickly come to PDD. That's proventricular dilation disease. We don't see it very often, honestly. It's caused by Borna virus. Uh, you would diagnose this with PCRs. Another diagnostic tool is contrast radiographs, where you would give the bird some barium and take X-rays over a span of about 2 to 3 hours to see how the barium is moving, and the barium actually coats the proventriculus, so you can see that the proventriculus is enlarged or dilated. Okay, again, there is no treatment for this virus, but NSAIDs like meloxicam and supportive care with fluids, etc., can help the bird at least survive longer till it can form an immune response to the virus. Another thing that you would see in the stool is completely undigested food just passing out of the stool. Earlier, this disease used to be called the macaw wasting disease because it was seen in macaws very often. And you would just suddenly see them losing weight, and nobody knew why until they did some testing and they discovered the virus. And it also spreads easily. So, if there is a bird positive for this, it needs to be separated immediately. Now, not all coronavirus positive birds will show these symptoms, and not all birds that have a dilated proventriculus have PDD. Okay, that's why testing is very, very important. So, this is again from a paper where they did radio contrast radiographs to see the dilation uh, in the ventriculus and the proventriculus. So you can see how it is dilating. All right, that's the proventriculus. All right, and that is my pun for the day. Thank you so much for listening to me, and I am open for questions.
Yeah, there are questions. Um, One of them is among. Hold on. How can we ensure the turtle or bird is healthy if we are getting them placed like if we are getting them from a place like Crawford Market?
Don't buy them from Crawford Market ever. It's the worst place to buy animals from, and you're 100% going to get a sick animal. because you won't know it's sick until you get it home and it actually starts showing symptoms, or you immediately take it for a checkup before you bring it home.
Ma'am, another question is, what are the antipsychotic drugs used for feather plucking in birds?
So what I used for this bird was alprazolam. You can also use haloperidol. Okay, so these are different antipsychotics that have been used, but after this, we use this after we've tried everything else with enrichment and bird calming music is something that I love very much. It's you get these bird calming. It's a channel on YouTube which has calming music, and it works wonders. It works wonders on cats and dogs also, and works wonders on birds. It really calms them down. So that is something we ask owners to start playing, and of course enrichment. We ask them to change the environment a bit. Of course, spend time with your bird, which usually helps. And unless we it's so far gone that we have to use antipsychotics. The contraceptive that we use is leuperolide. I think I am pronouncing it wrong. My brain is a little off, but yeah, uh, that is what we give injectably in the muscle for uh, hormone related feather plucking.
There's also one question. Among pistachians, are there any species who are more susceptible to PBFT?
All citizens are susceptible to PBFT if they're exposed to the virus. And since it's originated in Australia, so you would see it mostly in the Australian birds like cockatoos, galahs, corellas, and so on and so forth.
Can we just? There are no question. Yeah, there's another one. Can we use diuretics in turtle for edema instead of sugar solution?
So when it's a prolapse, no, I wouldn't use a diuretic because it's going to take too long to act, and I want the organ to go back in ASAP. So sugar solution is going to help me in 5 minutes rather than me waiting for hours for the turtle to pee and the edema to reduce. And that edema is usually because the organ is outside, as in it's getting strangulated through the small opening, not because it's a systemic thing.
There were some questions from Instagram where we put that ask a question post. It was a story actually.
Sure.
Is anorexia in turtle usually associated with imbalance in liver enzymes?
So anorexia would be associated with anything. Your animal is sick, it's going to stop eating. That's the first thing they do. So not usually a liver related thing. It can be related to whether the temperature, if they can't breathe, if there's a respiratory problem, they're not going to eat. If they are in pain, they're not going to eat. If they have eggs, they're not going to eat. So any kind of medical condition would cause them to stop eating.
Another one is, what is the basic care and management of turtles, and what are the essential questions to be asked?
Basic care and management, my god, that will be like a 1 hour discussion. Yeah. But so basic care for turtles, so let's talk about red earth sliders. They need a tank, you need an aquarium heater to keep the temperature, you need a basking area, you need a UVB lamp, that is just a basic setup. And so if you just Google red earth slider setup, you'll get a beautiful image of how their tank needs to be. And that is the minimum requirement for what they need.
Another question is, which is the perfect diet for turtles by which we can prevent the conditions like MBD, anorexia,
I think
etc.
we spoke about the dietary
Yeah.
requirements of turtles, like a balance of turtle food with fruits and
Hmm.
vegetables and some meat.
I think we did spoke about nutrition. Neha asked what turtle and tortoises that have been anoretic for a while. Uh, what would be a good nutritional support that we can offer? We did talk
So
about.
initially, of course, they will be dehydrated if they've not eaten in that long. So RL and DNS is what we give in combination. So fluid therapy we do normally at 10 to 12 ml per kilo, and then I think you all will learn this when you study fluid therapy is how to calculate ongoing losses and then supplement that accordingly in the fluids. So we would normally start at a basic requirement of 10 to 12 ml per kg. And I add a little bit of a liver supportive like Neohepatex or Belamil with my fluids when I give it.
Okay,
And
ma'am.
I don't
Uh,
start supplementally feeding them or oral feeding them till I have hydrated them properly. So that would be about a week of hydration, and then we would start feeding them, like tube feeding them if they're still not eating.
okay, ma'am. There's another question. How do you differentiate
Hmm.
whether an animal is brumating or if he is lethargic and needs investigation?
If your turtle or tortoise is not
No,
moving, please take it to the vet.
no.
It is not brumating.
Hmm. Just take him to
Not
the
not
vet.
not here. Yeah.
Are there any commercially available food brands for turtle? And if yes, would you recommend
There
some?
are lots. There are lots of total food brands. There's Tayo. There is Reptomin. If anyone is traveling abroad, you can bring back Zoomed pellets. Those are quite nice. Uh, Mizuki is a good one. There are many. So even in India now, there are plenty of total food brands available.
Um, there's another question. Parth asked
Hmm.
how you see future prospects in exotic animal treatment.
Oh, it's great actually. We see a lot more people adopting exotic pets because of space constraints in their house, because dogs and cats of course require more space, especially dogs. But they think that exotic animals are easy, but it's really not. But a lot of people adopting, so prospects are great because, and we're also doing a lot of good work, and people are more open to doing treatments and coming to the vet and getting diagnostics done. So it's looking up, and it's a pretty good future.
Um, from IVS in Malaysia, there's someone who's asking
Hmm.
that it is not a medical question, but do you allow international student internships in Criticare Vet Clinic?
Yeah, of course. The thing is, we don't have a formal internship program yet, but we definitely are open to having students from anywhere if they want to come and learn under us. We're definitely open to that.
Perfect. Ma'am, what surface is suitable for turtles and tortoise?
What surface, as in?
as in the place where they should.
So turtles need to be in water.
Hmm.
Tortoises need, I mean, they need sort of like a soil-ish, muddy this thing. But we normally get, uh, you can use a yoga mat for them, which is like, because you need to make an enclosure for them as well. So yoga mats work well because they're easy to clean also. Or you get, that fake plastic grass. As long as they're not eating it, they can walk around in it for fun.
So I think we're done with the questions. Is there anyone who wants to ask any more questions? Yeah.
Yes.
Hi.
Mm. So you first need to correct the hydration. Okay, you need to give them fluids because they are so dehydrated. Then you need to start slowly speaking to the owners. They can't immediately put them in deep water. They'll because they haven't been in water. You need to start slowly with shallow warm water. Start soaking them for a couple of hours a day, and then slowly increase the level of water over a month or two. But you need to give them fluids every day till they start eating, or at least till they are well hydrated. You need to take X-rays to see the internal organs and their status. If even after giving fluids, the turtle isn't passing urine or any urates, there's possibly severe renal damage, and reversing that might be very difficult. Um, and another thing that you can do, so whenever you give fluids, they need to be warmed up. Okay, so even the fluids need to be at a nice 28-30 degrees. So when we say, suppose I'm giving 10 ml fluid, I would fill it up in a 10 ml syringe and put it in like a warm water bath to warm up the fluid. Then I would squirt a little bit on my wrist to see if it's not. It shouldn't be too hot, of course. If it's nice and warm, that's when we administer those fluids. And once the turtle is a little better hydrated, you can look at tube feeding them. So tube feeding them, again, we get commercially available formula, which I actually source from the US. You get carnivore critical care, you get herbivore critical care, etc. You get different kinds. But if you don't have access to that, and it's a turtle, what you can even do is give the dog and cat recovery food that we get, which is a nice pasty concoction. This is not to be given to tortoises, please. This is only for turtles. Okay, because that's way too high in protein for tortoises. If you want to tube feed tortoises with something, it would be like vegetable juice and mashed up fruits or something. Yeah, if you don't have the formula. But then again, when you're tube feeding, the tube needs to go into the stomach. Okay, you need to be very particular about that. We use crop needles for that usually.
I think we're done with the questions.
All right. I hope you guys enjoyed this session.
We did. Thank you so much for joining us and enlightening us. It was such a nice experience for me.
That's great. I'm glad. If you think of any other questions later, you all can always, I guess, email or text, uh, and that can be sent to me whenever. So I can answer your questions later as well. Yeah, and if any of you all want to drop into the clinic, please let me know. You all can come and just see how we do things.
Or
Sure. No, I'm glad you guys are actually doing this so that you can practice well, and because you guys have to carry this on and at least do well for the patients that come to you. And you really need to push for diagnostics even with college. I know it's difficult, but you need to push them.